Hi, I am Dr.Nidhi Jain. I am a gynecologist working in Gurgaon. I am attached to Opulence Clinic, South City 1. So, today we'll be talking about antenatal care. Antenatal care is a very important part of a pregnant patient's journey through pregnancy. It involves not only her ultrasounds, blood tests, but also the doctor patient relationship. We as doctors talk to the patient, understand their problems, and try to maintain or try to build up a reputation with the patient and her family on the whole. Because many times there are a lot of things which are not mentioned in the books. The patients just want some psychological support, the patients just want to understand something, which it's always better in the form of a counseling that we talk to the patient. So it begins with the day your pregnancy test comes positive, and we suggest some blood tests which include your basic sugar, thyroid, blood group, and some other basic tests which are necessary for the whole of the pregnancy. And we usually do an ultrasound at 6 weeks to understand the location and to know the cardiac activity of the baby, of the developing embryo. Most of the times, if the patient has any complications, we may have to shift the timing of the ultrasound. It can be done early or late, depending on if she has any bleeding or any other problems. Next ultrasound we usually do around 9 weeks, because before 12 weeks we cannot assess the baby's heartbeat in the OPD. We are dependent on the ultrasound. So as we go through the first trimester, at the end of first trimester around 12 weeks, we do the level 1 scan. After the level 1 scan, we usually do the aneuploidy screening, in which we test for any possibility of genetic problems in the baby. Following that, an anomaly scan is done at 18 to 20 weeks, along with some blood tests. We usually want to perform a fetal echocardiography, which is optional, but it is a good thing to evaluate the baby's heart in detail at around 25 weeks. Following that, a growth scan is done, that is in the third trimester. So second trimester usually is a very good period for the patient, because they they usually feel much relaxed, and the symptoms of first trimester like vomiting, nausea subside. So coming to the third trimester, usually 2 scans are done for the growth of the baby and some usual tests, which involve the testing of sugars, hemoglobin, platelet count, liver function test, and a urine test. And around 37 weeks, we decide further for the mode of delivery. For further information, you can please subscribe to our channel and call on the number. Thank you.